My name is Libby Brown, and I am a physiatrist at the Hospital for Special Surgery. I work full-time in Connecticut in the Wilton and the Westport offices. In my practice, I see a variety of patients. I specialize in physical medicine and rehabilitation, so during that training we focused a lot on patients who had musculoskeletal conditions. So for example, a lot of knee pain, hip pain, ranging from all ages. I treat ages 18 and up currently. I also specialize in sports medicine, so I'll see any athlete who comes through. And then I also chose to specifically focus in pelvic health. And so I see a lot of women who are pregnant and peripartum come through my practice. So pelvic health is something that I think is a growing topic. I think it's something that patients don't necessarily have easy access to purely because it's not available. People also are nervous to talk about it because, as you can imagine, it's difficult to talk about topics related to pelvic health. And so I want to make myself available to anyone who is experiencing kind of conditions in the world of pelvic health. These might include chronic pelvic pain, urinary incontinence, constipation, pain with intercourse, and then pain in pregnancy and afterwards. And so by the time a patient gets to my office, they've exhausted a lot of resources and are just looking for some relief, and I am happy to provide a musculoskeletal perspective on relief of pelvic pain. Seeing success in a patient brings me the greatest joy in my job. That is what we as physicians strive for. So some patients, it's a really quick, straightforward journey. Some patients, there might be more ups and downs, or it might take longer to figure out exactly how to best treat their pain or function. And so when we do finally get to a point where the patient is happy and functioning well, that's how I define success for them, or how they define it for themselves, then I feel like we've made it, and that makes me happy.